is the pathogenesis and the pathology. You can take it for now. Is it clearly available? Okay. Here in the etiological factors, abhyantara and bahya karanani and sharirika manasika both are there. And again sannikrishta viprikishta also there. As told in the Jwara Chikitsa, there are so many nidanas classified in different way. Generally we need two types are important. One is sannikrishta, other one is viprikishta. Generally viprikishta, abhigata sannikrishta nidana. And sannikrishta nidana in the when the doshas becoming prakopa related to the season or the apatyas. And sharirika manasika both are there. Due to this one, dhatu the maximum effect of the dhatu in the vatvyadhi is rasa dhatu. And highest snigdha dhatu is majja, mamsa, meda. These are the three snigdha dhatus and shukra. Shukra is sukshma and most essence of the dhatus. So any of these snigdha dhatu becomes kshaya, makes vata prakopa. Rasa kshaya is more susceptible because it needs in our work, daily work, and with the immediately related with the food. So any change with the food habits and work first affect the rasa dhatu. So stula ojas in this one are affected. So vata prakopa are faster. So dhatu kshaya nidana atiseva, not in the mild formation. This leads to dhatu kshaya. It may be anywhere. Sroto riktata develops. Dhatu kshaya, sroto riktata, emptiness. Snigdhani guna related with the poshaka bhavas and dharana bhavas of the dhatu. And here vata travels here and fills it. Empty places, rikta places. Hello. Can you follow?
Yes, sir.
Can you follow?
Yeah.
Okay.
Easy, sir.
Do you feel lethargy?
No.
Tired? Okay.
Very
Vata
simple.
Sancharana and Purana. So this makes two type of pathology. One is Anya dosha sammochana, other one is avarana. So again these two conditions develop into Udena of doshas, Sammorchana with doshas and avarana. These three conditions develop. This is settling of the disease. Prakopa, Prasara, Sthana Samshaya. In Sthana Samshaya, this settles in the different avayava of the body, different indriya, different doshas and dhatus and malas. Dosha, dhatu, mala, avayava, indriya, all are the susceptible places for the disease. So different type of name also given. If it is settling in the pada, it may be Pangu or Kanja or Rudrasi. And there are different names are given, according to the appearance of the disease. Okay, are you clear this now?
Yes.
Okay.
सर एक क्वेश्चन था,
ठीक है।
ये जो सर वायु बढ़ता है
हाँ,
वो हम अवस्थापाक में जो वायु बढ़ता है वो समझना चाहिए या धातु का पाक होके?
वेरी गुड, वेरी गुड. ये वाता का this point I am not discussing.
Yes.
Just I follow this, keep writing, don't forget. See, vata is having nourishment
Yes.
from the ahara paka avastha. It is only nourishment. But vata exists all over the body in different places.
Yes.
And it is having different names.
Hmm.
It is prakrita vata. Even though it is not supported from the pakvashaya, even in the dhatu, kshaya makes prakopa there itself. It is vyanavayu in some place. And some trauma is happened. What will happen? Vyanavayu will not wait for the paka, avastha, ahara paka. Immediately it will become prakopa due to the trauma, aghata, abhigata. Same way, in the disease, this pathology occurs in the body. It may not support it from the ahara paka, but in the avastha paka, this supports. Once vatvyadhi is getting started,
Yes.
then what will happen? Vata is already prakopa in the body.
Yes.
It needs help from the pakvashaya,
Yeah.
sthana. Sthana nourished from the avasthapaka. So avasthapaka vata will affect the disease in the body. So for the avasthapaka, we control with the food and Deepanapachana. In Vatavedi is always Deepanapachana is stored.
Yes.
This is having Ushna Guna, which is Vatahara. And this Deepanapachana regulates the Srotogati of the Annava Srotas. And Pakvasha may be clear. Then every treatment is mainly targeted to the Pakvasha.
Yes.
So for that purpose, Basti is 50% of the treatment of vatvyadhi. That is the way.
Okay, sir.
That's a good question.
Yes.
What was the question?
The vata, where it gets nourished in the disease condition, that is related with the from the Pakvashaya. From the Pakvashaya is supported with the Avasthapaka. Avasthapaka is only temporary.
Yes.
Nishtapaka is the final. So Nishtapaka, Ahara Dravyas affects the Vatavyadhi.
Yes.
Because it's final. Only this is that vata already it is existing as a poshaka bhava. That is supported by the avasthapaka. All the three dhatus are supported by the avasthapaka. This is only temporary condition. So ahara is needed for the dosha, for dhatu and mala and kriyaha. So agni is very important. Kaya chikitsa, kaya agni is important. Okay, your question? Clear? Okay. Yes?
Sir, for me, this concept of avasthapaka are not clear.
See, food first of all digested in 3 stages. First becomes Madhura Avastha or Ama Avastha. In this Avastha, till the completion, it having pronouns of Kapha. So this is related with the Kapha Poshana. From this, dosha Kapha is nourished. That stage. Next becomes Amlapaka. Amlapaka or Pachamana Avastha. Here, the it is Katuvipaka. Katupaka. So, nourishes the Pitta. In the later stage, it becomes Vata Prakopa. Vata nourishment. Last stage. Amavastha, Pachamana, Pakku Avastha. In the Pakku Avastha, nourishes the Vata. And this is almost completing the digestion process. Then becomes Nishtapaka. In Nishtapaka, not related with the dosha directly. Then, according to the Ahara Guna, it becomes Madhura Vipaka, Katu Vipaka, these two. Amla or Katu Vipaka, I think. So, here related with the Vata Pitta Kapha in the body effects, or according to the Dhatu Poshana. In the Avasthapaka only related to food, which is dosha, not with the Dhatu. Nishtapaka related with the Dhatus.
So there will be Dhatvagni working.
See, here Jataragni is working till the Nishtapaka. After Nishtapaka, it reaches to the, is known as Ahara Sarabhaga. Now Ahara Sarabhaga divided into Mala and Dhatu by the Jataragni and Vata. It is Sara Prithakkarana. And Sarabhaga next enters to the Rasadhatu. Then starts with the Dhatu Agnipaka. So then it nourishes the all dhatus.
सर फिर ये जो रस धात्वाग्नि काम करके जो मल कफ बनाती है और ये जो रस मल कफ हम जो बोलते हैं
In the Rasadhatu, when reaches this Ahara Sara,
Yes.
Bhaga in the Rasadhatu, Rasasrotas,
Yes.
then Dhatvagni of Rasa, Rasadhatvagni digests it again. Again digestion makes it different places, different kinds. One is Poshana for the Rasadhatu.
Yes.
So this is Stula Bhaga.
Yes.
Stula Bhaga remains as Rasadhatu.
Yes.
Sukshma Bhaga will go to the next
dhatu.
Rakta Dhatu food.
Oh.
Upadhatu and separated and travels to its places.
Oh.
And Malabhaga.
Yes.
Malabhaga also cleared in the different places. Rasamala,
Yes.
Rastamala,
Yes.
Mamsamala, Medomala, everything is stored. Only Ojas is having no Mala or Upadhatu.
सर
Shukra is
माय क्वेश्चन इज सर रसमल कफ एंड जो अवस्थापक के बाद जो कफ बनता है मधुर अवस्थापक वो डिफरेंट समझना है सर या एक ही समझना
वो
है
एक ही
एक ही समझना
और Rajekshma disease,
यस
Vitakta Ahara, this one, Rasadhatu,
यस
told as Kapha, Steven.
यस यस
That is Rasadhatu, and Rasadhatu is similar and near to the Ahara Rasa. So Kapha is related with that one.
Okay.
But that is Kapha is Poshana Kapha,
यस
Poshaka Kapha. Whereas Dushakta Kapha from the Ahara
So
Pasha.
Prakrut and Vikrut cough, we
Prakrut
can
and
understand.
Vikrut.
Yes.
And in the Ahara also it is Prakruta because timely it is digested.
Okay.
After that no supply. But it's near to the Rasadhatu.
Okay.
So it is in the Kapha can be Dhatu. And if it becomes Vidattata, then it has dosha.
Okay. So,
Vidattata in Rajashma he told.
yes.
And undigested Rasadhatu is Rasa with the Ama only, but not the Kapha. Kapha and Ama having similar properties. So we can just, this is theoretical. In the practical, this Rasadhatu Pachana, we use generally Jataragni Pachana medicines
Yes.
only. Trikatu, Panchagola, all these are with the Rasadhatu Pachana. Whereas in the Rakta we need different, particularly Chaturdhata. In the Medhadhata again, we need different medicines. It's deeper. So Dhatvagni is nourished from the Jataragni. So everywhere we support the Jataragni and next Dhatvagni. And the medicines, Rasha transfer medicines works in the Dhatvagni particularly and Bhutagni. It is very less.
Okay.
So if you see, you are giving Trikatu or Pachana, it works in the food. Avstapaka only.
Okay.
Whereas you use prepared medicine just like Tikta Rasa or other Kashayas or Panchakola, this works in the Ahara Sarva. This is higher level.
Dhatu.
In the Apachana in the Dhatus, then we use Rasa Oshadis
Okay.
and Vishas.
Yes.
Ativisha, Ativisha, Kuchala, Vatsanaba, these are works in the Dhatu.
Okay.
And prepared with the Rasa, mercury, it actually works in the Dhatu and Bhutagni.
Okay.
So Navajivana Rasa works in the Bhutagni. Agnitundi works in the Dhatu and Bhutagni. And Aprata Basma works in the Bhutagni. Bhutagni particularly. So this is the difference. Prashasri can do this. Otherwise it is difficult. Yes, any doubts more?
Sir, I remember Charmi ma'am in her OPDs always when diagnosing, taking history, she is diagnosing avastha of the diseases, like this Amla avastha and Skatu avastha. That one how we can assess?
Pardon me?
Charmi ma'am,
Yeah.
according to the disease avastha she is diagnosing, like it is according to that, like it is Amla avastha, it is Skatu avastha. That how, because Charmi ma'am also was your student.
Yeah. She is in the origin concept only she is talking. And generally diseases are known as Amavastha, Pachamana and Pakavastha. In these three, Amavastha, Madhura and Pachamana Amla or Pakavastha or Katu we can consider.
So how we can recognize it? Because I never understand this concept. For patients, which avastha is there according to the symptoms?
See, disease having three avasthas. Nava, Madhya and Jirva avastha. This is time related. In this time, first it may related with a particular dhatus. And dhatu then in the Madhya avastha and it becomes more severe. And in the Pakva avastha, those are separated from the dhatus and generally goes out. And in the Amavastha, they become more prakopa and combining with other dhatus. It is end. And in the Pachamana avastha or Madhya avastha, doshas are more virulent and always active and combining with the disease. And in the Pakva avastha, they are slowly doshas separating from the dhatu and disease becoming lesser. This separate dosha can be expelled or shodhana by the chikitsa or pachana by the treatment. This thing I think we can correlate. This is just justification. See, the one thing is that always study the Shastra and make adhyayana, study yourself. What is possible? How and why? First questions are there. And then think how it is developed. Then we can have some knowledge. And adhyayana is important in this one. Then practically try to see. Generally, what happens, where the doubt occurs, we hit the target. We are not finding that it is target, but it is clear. We given Sudarshana Churna, patient had the fever. He recovered. So, what will think? Sudarshana relieved it. how and why. This is, the answer will be given from the Shastra. That we have to think. What will happen? With the justification or understanding, we can assess other diseases. Sudarshan is common. A compounder can give, public can himself take that preparation. What has happened in the corona? COVID-19. The same thing happened. Somebody is taken Sudarshan Churna. Of course, it will relieve, but they are having no Shastra justification. Somebody given Panchatikta or Mahatikta, they record faster. Why? And other person given Tribhuvanakirti or other powerful drugs where it is needed. Then our Shastra will guide us. It is record, okay, we know it was simple fever. It is having not much powerful or virulent. Corona is virulent and it is very powerful. Our body is unable to resist it. So in that condition we need high potent medicines. So if you give Tribhuvanakirti along with other medicines, it will work. Otherwise, Lakshmi Narayana Rasa, so many medicines are given, it is working. If you are giving only Sudarshan Churna, patient will collapse. So this is our adhyaya. If you are knowing Sudarshana relieved some patient's fever, you should aware why it is relieved, where it is work. In the same way, vatvyadhi, this is more complex. Here, if you are giving relief, why we should aware? For that purpose, we need the nidana, we need the samprapti, and we should understand the physiology of the body and where it is affected in the sthana, indriya, dosha, dusha, mala, or where it is affected. That we should understand. And books tell you what medicines can be given in the Gridrasi, but you should aware how it is clear. Then it is okay. Or just giving modern interpretation, this Kuchala makes nerve irritation slower or clears. Vatava Chintamani makes Udirna, excitement of the nerves is diminished. So clearing. This is not sufficient. We should be able to know how the disease developed and how the medicine affected. Our Shastra medicines are more related with the Samprapti Vigatana. Whole Samprapti it affects. That is its beauty. Some other medicines also there, combinations are made for these purpose. For doshas, needed only 3 medicines. Vata, Pitta, Kapha. But we cannot clear all the disease. We need to affect the dhatus. We need to treat the srotas. We need to increase the agni. We should clear the sthana. We make more power, potency in the dhatus or sthanas. We should make swastha mana. Then only the disease will go. So, in this concept, they are comparing different medicines. So many yogas, Ghrita, Taila, Savarishta, for that purpose it is developed. In old books, we can find only few combinations. Whereas in the latest books, we find so much. If you study in the 21st century, you can find numerous combinations. From the 19th century, the combinations is very high. In the Yoga Ratnakara period, I think 8th century, from there they started the combinations and along with the research. Same time, Unani medicines also get entered into the Ayurveda. In the 11th century, from that time, the combinations is highly sophisticated. The concept is same related with the Samprapti Vigatana. And something that is special for Rasavadi or Dhatuvadi means making some metal into gold. Who can? These have only one concept. Whatever I give, body must be changed. Just like lower metal into gold. So if you get a diseased body or old age, he should become youth with full health. That is the concept of Rasavada. It is also possible. It is dangerous also. It is possible. Okay.
Thank you.
Welcome. Next class is the name of the diseases and different pathologies. Shortly I will give, not detailed. Otherwise it will take more than the 10th class. And some typical common treatment methods are there, that I also tell you. It is useful in other diseases also. Just like Pakshadhati Vinechanam, importance of the Basti, and the importance of the Sneyana Sredana. This is treatment, not Purakarma. It is Purakarma in the Panchakarma, but it is treatment in the Vatvyadhi. Shortly we will discuss. Sorry for the late. I'm doing my own work.